let's start then. So today I'm going to teach you about the joints, or which is also called as articulations. Okay, they are not separate, they are one and the same. Yes, coming to the joints. What do you mean by a joint? Do you have an idea? Usually when you talk about the joints, joint means the one which is going to joining something. Two surfaces, if they join, that is called as joints. Okay. But here in the human anatomy and physiology, we call when there is a contact between two bones or between a bone and a cartilage. Okay. Point of contact between two bones or between a bone and the cartilage, that is called as joint. Okay. This joint is also called as articulations, or it is also called as arthrosis. Okay. Study of joints is called as arthrology. The study which deals with the joints, it is called as arthrology. Okay. Arthro means joint. Logos means, you know that it is study. Now coming to the classification of joints, very, very important. Okay. So this classification is made based on two things. Okay. One is structural classification and the other one is functional classification. Now here structural classification means based on their structure, physical thing, like what can we see with our eyes, that is called a structure, right? So based on the structure, they are classified into fibrous joints, cartilaginous joints and synovial joints. Okay. So now what parameter they are taking here? The parameter is whether there is some space between the joint. Okay. If there is space between the joint, or if there is presence or absence, depending on the presence or absence of the space between the joints, we are classifying the joints into fibrous, cartilaginous and synovial joints. Okay. Now, first we will see whether there is a presence of joint, space or not. Okay. Okay. So in fibrous joint, in the fibrous joints, there will be no space. Okay. In the cartilaginous joints also, there will be no space. Whereas the space will be present in the synovial joint. Okay. So what is this space called as? This space is called as synovial cavity. The space is called as synovial cavity. Now you can see here in the fibrous joints, I have written that it is having no synovial cavity. Means there is no, if there are two bones, there is no space between them. They are like this. Okay. If there is space, synovial joint. If there is no space, either it is fibrous joints or cartilaginous joints. Okay. Now, fibrous joints and cartilaginous joints. What is the difference in them? The difference is when there is no space between them, it means that they are held together by a tissue. Okay. So they differ in the different tissues which are present, which is present between the two bones. Okay. It means that when there is no gap, it means that they are bound. If they are bound means something is there which is binding them. So what is that? So in the fibrous joint, the one which is present, which is going to bind the two bones is dense irregular connective tissue. Okay, dense irregular connective tissue is the one which is going to bind the two bones of the fibrous joint. This dense irregular connective tissue is very rich in collagen fibers. Okay, and coming to the cartilaginous joints. So as I told you, there will be no cavity. Again, as there is no cavity, it means that they are bound to each other with the help of some tissue. So here, the bones are held by cartilage. The bones are held by cartilage. And coming to the synovial joints, here the synovial cavity will be present, means the bones are like this, apart from each other. There is a presence of synovial cavity. When the when the synovial cavity will be present, but they are held at one place. They are not bound to each other, but they are held at one place with the help of dense irregular connective tissue. Okay, am I clear? If it is clear, please type clear. Clear in the chat box. Yes, no one is listening to this. Please type clear. Okay. Now coming to the functional classification. So how they are classified based on their function. Okay. Function means what? Now what is the function of a joint? Okay. Why joint is present? First you tell me why joint is present. Is there any requirement of joint? Okay. See, for example, if you imagine continuous bones are there, there are no joints. Will I able to bend my elbow? Will I be able to bend my fingers? Will I be able to turn my wrist? No. Will I able to turn my head? No. So what is the primary function of joint? To give movement, to allow movement. Okay. So depending upon the movement the joint is allowing, the functional classification of joint is synarthrosis, amphiarthrosis, diarthrosis. Okay. Synarthrosis, amphiarthrosis, diarthrosis. Okay. Synarthrosis means immovable joint. Okay. Immovable joint. Name some immovable joints in your body. If anyone can name it. Immovable joints. Can you name it? The immovable joints are the joints which are present in your skull. Okay. The joints which are present in your skull and few of your facial bones also. They won't move, right? They are immovable. Okay. Amphiarthrosis means they move only with a restriction, slightly movable. Vertebral column, they move but with restriction. We cannot just bend 360 degrees, right? You can bend forward, but can you bend backward? No. Okay. So slight movement is possible in amphiarthrosis joints. Okay. Whereas the last one is diarthrosis. Diarthrosis means the joint which is allowing free movement, freely movable. Okay. For example, if you see the shoulder bone, freely it is movable in all the directions, right? Once you can move your shoulder joint and you can see it, you can check, right? So it is freely movable joint. Now, in detail, we will be seeing about different joints. Okay. The first one is fibrous joint. Okay. This is a first structural classification, fibrous joint. What did I say? There will be no synovial cavity. There will be no synovial cavity. They will be bound to each other with the help of dense irregular connective tissue. Right? Remember both the points? Remember? Yes? Okay. Now coming to the different types of fibrous joints. Okay. We have three types of fibrous joints: sutures, syndesmosis, interosseous membrane. Okay. Sutures, syndesmosis, and interosseous membrane. So, what are the sutures? What are syndesmosis? And what are interosseous membrane? Okay. Now, on what basis they are divided into three? Okay. They are divided on the amount of dense irregular connective tissue present between the two bones. Okay. What did I say? Fibrous joints, they are having some tissue in between the two bones. They are connected to each other, right? So based on how this tissue is present, whether it is present in the thin layer, whether it is present in the form of a bundle, whether it is present in the form of a sheet. Okay. So coming to the sutures. Sutures are the one where the fibrous joint is composed of a thin layer of dense irregular connective tissue. Very thin layer of dense irregular connective tissue. Okay. Example for suture is your bones of skull bones. Okay. Now, these sutures, as the human body grows from the childhood to the adulthood, the suture will be developing. Okay. For example, the suture example is coronal suture. Okay. coronal suture, which is present between frontal bone and parietal bones. Okay. Now you might have seen in the skull. Okay, you in the practicals, did you see the skull? Okay, on the skull there were lines on the skull. Yes. If yes, then please type yes in the chat box. It will be interactive. If you interact, then you will enjoy the classes more. Okay, type yes in the chat box. Yes. So, right. So, in the fibrous joint, the example is coronal suture in the sutures. Okay. Now, sometimes what happens is this suture will be replaced by bone as the human body grows. When you see in the infants, okay, when they are newly born, the bones will be very smooth. Okay. Once you press here, it won't be so much hard. Okay. Slowly as they grow, that sutures will be replaced by bones. And this is called as synostosis. Okay, it is called as synostosis. There will be no movement in the suture. Can our skull bones can move? Can the bones of the skull move? No, right? So yes. So there will be no movement. The next class or the next type of fibrous joints are syndesmosis. Okay, syndesmosis, they are going to give you some greater distance when compared to suture. Okay, little bit more distance will be present between the two bones. Okay, greater distance between the articular surfaces. Articular surfaces means the surface which are going to attach to each other. Okay, so there will be greater distance and the dense irregular connective tissue will be present in the form of bundle. Okay, a bundle of dense irregular tissue will be present. Okay, now as it is present in the form of a bundle, it will allow slight movement. Slight movement is possible with the help of syndesmosis. Okay, now for example, here the best example is first one is distal tibiofibular joint. Okay, you can see here. Distal tibiofibular joint, here you can see. And the next example you are having is gomphosis. Okay, gomphosis means the one. Gomphosis means you remember gum. Gum. Where is the gum present? In the oral cavity. So when the cone shaped your teeth is fixed in the gum, into the socket, okay, that is called as gomphosis. Okay, that comes under syndesmosis. Okay, it allows slight movement. When it becomes weak, it moves, right? It is not that hard. Okay, so that is the example of syndesmosis. And the last one is interosseous membrane, where the dense irregular connective tissue in the neighboring bones will be present in the form of a sheet. A complete sheet will be present. And here there will be few movements which are permitted. And the best examples for this is presence of dense irregular connective tissue between the tibia and fibula. You can see here. Okay. And also between the radius and ulna. When you have studied the bones part, okay, in the radius ulna and in the tibia fibula, you have seen the structure. They are both attached with the interosseous membrane. Okay, so that is about the interosseous membrane. Coming to the cartilaginous joints. Now, cartilaginous joints are the second type of joints. Now, they also do not have space between them. The bones do not have space between them. There is absence of synovial cavity. They are connected to each other with the help of a cartilage. Okay. Now, again, they are divided into three types. The examples in three types, they are synchondrosis, okay, synchondrosis, symphysis, and epiphyseal cartilage. Synchondrosis, symphysis, and epiphyseal cartilage. Okay, so coming to the synchondrosis. Synchondrosis. Here, the connective material will be, I told you, the connective material should be cartilage. Now, which type of cartilage is present? That you have to remember. Okay. So, in synchondrosis, you will be having hyaline cartilage. You will be having hyaline cartilage between the bones. Okay, the connective material will be hyaline cartilage. And as the cartilage is present, cartilage is somewhat flexible, right? So, it is slightly movable, very slightly movable, or sometimes it is immovable also. Okay, now what is an example for the synchondrosis? Here you can see presence of cartilage here. Okay, so that is called as synchondrosis. It is the joint between first rib and the manubrium. This is the manubrium of sternum. Sternum means what? The chest bone which is present, right? That is sternum. Now sternum, the joint, the cartilage which is present between the sternum and the first rib. Okay, first rib is somewhat flexible because when you breathe, the ribs also expand, right? So that movement is allowed by the synchondrosis, hyaline cartilage. Okay. Now, coming to the symphysis. Okay. Symphysis, for best example, you might have seen pubic symphysis when you have studied about the pelvic cavity. Okay. When we have studied about the pelvic cavity, we have seen the pubic symphysis where it is present between the two pelvic between the two pelvic bones. Okay, so what it is, the articulating bones are covered by hyaline cartilage and are separated. Now this hyaline cartilage is again separated by fibrocartilage. Okay, small disc, flat disc of fibrocartilage. Okay, they are covered. They are covered by hyaline cartilage, and again they themselves are separated by fibrocartilage. That is the difference, the structural difference between synchondrosis and symphysis. Okay, they are also slightly movable. Example is, as I said, pubic symphysis is the best example for the symphysis. Now coming to the last one is epiphyseal cartilage. Now epiphyseal cartilage means usually when you have studied about the structure of a long bone, you might have seen diaphysis is the long shaft. Then on the ends you will find epiphysis. Okay, there is a point between epiphysis and the diaphysis which is called as epiphyseal plates. They are going to help in the growth of bones. That is nothing but your epiphyseal cartilage. Okay, so these hyaline cartilage centers during endochondral bone formation, and the example is epiphyseal growth plate which is going to connect your epiphysis and diaphysis. Okay, and this is immovable. It allows the growth, but it doesn't allow any movement. Okay, am I clear? If it is clear, please type clear in the chat box. If it is clear, okay. Are you listening? Yes. Coming to the last part or the last type of joints, which is called as synovial joints, which is characterized by presence of synovial cavity. Synovial cavity will be present in the synovial joints. As the synovial cavity is present, they allow a good amount of movement in the joints. Okay. Now, so these synovial joints, first we will see the structure of the synovial joint. Okay. Now, if you one capsule which is called as articular capsule. Okay. Now this articular capsule has two membranes, inner synovial membrane and outer fibrous membrane. Okay. Inner synovial membrane and outer fibrous membrane. Now this outer fibrous membrane is actually continuation of periosteum of the bone. You can see here. This periosteum is continuing in the joint as fibrous membrane of articular capsule. Fibrous membrane of articular capsule. Okay. Now, then you have inner synovial membrane. Now, what is now the space, that is the synovial cavity, will be filled with synovial fluid. This synovial fluid is actually secreted by the synovial cells which are present in the cavity. Okay, and it mainly consists of hyaluronic acid. It mainly consists of hyaluronic acid and interstitial fluid, which is filtered in the plasma. Okay, it is filtered from the plasma. Some fluid will get filtered here, and that fluid along with the hyaluronic acid together, it is called as synovial fluid. Okay, now there are different accessory structures in the joints, like you are having articular surfaces, you are having ligaments. Okay, articular ligaments. Okay, so these ligaments are going to help in the attachment of the bones. Okay, so that is articulating ligaments. There are also certain structures called as meniscus. One structure, then it is called as meniscus. If we are calling it as a plural, we will call it as menisci, knee. Okay, which are present in the knee joint. Okay. Okay, now it forms a thin layer on the articular capsule, and the main functions of synovial fluid is very, very important. Synovial fluid functions. Okay, it is going to help in the lubrication. Okay, so when the two bones are there, when they are working together, they may rub with each other, right? So to avoid that rubbing, it provides lubrication to the joint. Okay, then it provides nutrition to the joint, nutrition to the cartilage and the other tissues in the joint. It is going to supply blood and oxygen to the joint, and it is going to remove the waste from the joints. Okay, immune function. Some type of immune cells also are present in the synovial fluid, giving the synovial fluid give some immunity, so that it is going to protect the joint from the infection and the injuries. Okay, and they are also going to help in, it is also going to help in the absorption of shock. Okay, why the shock absorbers are present in the cycle, bicycle? Okay, why they are present in the motorbikes? That is so that there will be no damage to the person who is sitting. There will be no damage to the vehicle, right? In the same way, they are also going to, this synovial fluid is going to help, act as a shock absorber. Okay, now what happens to the synovial fluid when you sit continuously? When you sit continuously, what happens is there will be no movement of the synovial fluid. You're not moving the joint. You're putting it stagnant. So what is happening? There will be no movement. So when there is no movement, the synovial fluid will become more viscous and it will be very difficult to move. Okay. When you move it, then automatically it sets again and it will become less viscous and there will be easy movement. Okay. And this is the reason why when you exercise, before exercising, before starting the exercise, you are going to do some warm up. Warm up means what? You are moving all your joints so that there will be easy flow of synovial fluid in the joints and there will be no injury to the joint. Am I clear? If it is clear, please type clear in the chat box. Type clear in the chat box. Yes. Now coming to the types of movements at the synovial cavity. Okay, synovial joints. So the first movement will be your gliding joints. Okay, so here gliding joints means what? Two flat surfaces will be there and there will be moving like this. Gliding, gliding, gliding like this. Okay, so really flat bone surfaces move back and forth or sometimes side to side, like this, side to side. Okay, so there will be no alteration. When there is movement, there should be some alteration in the angle, but here in the gliding movements, there will be no alteration. Very important point. In which type of joints there will be no alteration in the angle, then you can say that it has gliding movements. Okay, limited movements, and mostly these joints will be, these movements, joints will be seen here. Movements will be seen here in the intercarpal and intertarsal joints. You can see in the diagram, intercarpal and joints. Coming to the angular movements. Now, here, why they are called as angular movement? Because when you move, there is some change in the angle. Okay. So, what are the different angular movements you have? Now, first, remember the diagram. If you want to remember the angular movements, you just stand up, you practice yourself. Okay. So, flexion. Flexion means what? Decrease in the angle of articulating bones. Decrease in the angle of the articulating bones. Extension. Increase in the angle of the articulating bones. This is a point I am putting. I am making it flexion. Okay. I am going to decrease the angle. You can see angle here. Okay. See in the elbow. Okay. Flexion. Extension. Flexion, extension, flexion, extension. You practice like this. Then only you will remember about the angular movements. And also you will never forget in your lifetime. Okay. That is flexion and extension. Hyperextension means you're the same thing, you're moving back. Hyperextension. Okay. Continuation of extension will be called as hyperextension. In this diagram, you can see. Okay. Flexion, extension, hyperextension. Here also you can see. Flexion means you're going down. Extension means going back. Hyperextension means still you're going back. Okay. These are the three examples. Then lateral flexion. Lateral flexion means sidewards. It is present in the vertebral, mostly intervertebral bones will be involved in the lateral flexion. You can see in this diagram. Okay. How? Turning towards. Then it is called as, this type of movement is in lateral flexion. Coming to the other angular movements. Abduction, adduction. Okay. Adding means you are adding something. Abduction means you are removing something. Okay. So abduction means movement of bone away from the midline. Midline means your vertebral. Okay. So if it is moving away from the midline, it is called as abduction. And if it is moving towards the midline, it is called as adduction. In the diagram, you can see here. Abduction, adduction. Abduction, adduction. Okay. Now, circumdation. Movement of the distal end of a body part in a circle. If you are moving the wrist joint in a circle, then it is called as circumdation. Okay. This examples are there. Many examples are there for abduction and adduction. In the shoulder joint, in the wrist joint, in the hip joint, in the metacarpophalangeal joints. Okay. Now coming to the rotation. Rotation means one bone revolving along its own longitudinal axis. Okay. Revolving around its own longitudinal axis. For example, you can see here, you are turning your head like this, but it is going to have the same axis. Along the axis only it is going to revolve. Okay. We can see this shoulder joint. Okay. It is going to revolve on its own axis. Even hip joint can also come under rotation. Now there are certain special movements. Okay. So what are those special movements? Elevation. Elevation means superior movement of body part. Superior movement of body part. You can see here. Elevation. Okay. Elevation means like this. Depression means like this. Going down. Inferior movement. Superior movement means upward movement. Inferior movement means downward movement. If you are elevating, depression means depression. Okay. Protraction. Protraction means anterior movement. Means you are moving your bone forward. Anterior movement of body part. That is protraction. You will do like this, no? That is protraction. Retraction means opposite to it. Posterior movement. Anterior movement, posterior movement. Elevation, depression. Protraction, retraction. Okay. Inversion. Inversion means turning it away from the midline. Okay. Medial movement of sole. Okay. Eversion means lateral movement of sole. Lateral movement, medial movement. Medial movement means towards the vertebral column. Anytime. If you come across a word medial in anatomy, it means towards the vertebral column. Lateral means away from the vertebral column. Remember this, okay? So inversion means movement medial towards the vertebral column. Eversion means lateral, away from the vertebral column. Now, dorsiflexion. Dorsiflexion means bending the foot in the direction of dorsum, means upward direction. Okay, foot, if you're moving upward, it is dorsiflexion. If you are moving the foot downward, it is plantar flexion. Okay, then you are having supination. Supination means movement of forearm that turns palm anteriorly, like this. Supination. Pronation means like this. Palm, it is moving anteriorly. Supination. Pronation. How you will understand this? You know, two positions, anatomical positions. Do you remember? Supine position and prone position. Supine position means if you are facing, when you are lying down, and if you are facing towards the sky, supine. If you are facing towards the ground, prone. Okay. And the last one is opposition. Opposition means if you are crossing your thumb to the opposite end, that is called as opposition. Remember, if you do these movements and call it by names when you are doing it. For example, elevation, depression, protraction, retraction, then inversion, eversion, dorsiflexion, plantar flexion, then supination, pronation, opposition. Then you need not take any textbook, read it, and remember. Okay. Very easy to remember when you do this. Okay. So these are the different movements in the joints. Now coming to the types of synovial joints, we are having plane joint, hinge joint, pivot joint, condyloid joint, saddle joint, and ball and socket joint. Okay. So coming to the plane joint, plane means plane. Articular surfaces will be plane. Examples you are having is acromachioclavicular joint, carpometacarpal joint, intercarpal joints, all mostly the bones of the wrist will come under this plane joints. Okay. Hinge joint means there is one convex surface, there is one big concave surface. Concave surface, convex surface. If it is like this, then it is called as hinge joint. Examples you are having here is elbow joint, knee joint, ankle joint, interphalangeal joint. Okay. Pivot joint means there will be one rounded point, along that the other bone will be revolving. That is called as pivot joint. Example you will be having is atlantoaxial and radioulnar joints. Okay. Atlantoaxial means in the skull. Okay. Next, condyloid bones. Condyloid bones, these are oval shaped projections that fit into oval shaped depression. Okay. Means a slight projection will be there and slight depression will be there. Not concave or convex. Slight, very slight depression, very slight projection, and there will be joint formation. That is called as condyloid joint. Example you are having is radiocarpal and metapharyngeal joints. Okay. Next, you are having saddle joints. Saddle joint means there the one bone will be present in the form of a saddle, like how you put your foot in the saddle of a horse. In the same way, there will be the bone present. Okay. Example here you are having is carpometacarpal joint, trapezium, between trapezium and metacarpal of thumb. Okay. And the last one is ball and socket joint, where you know this, like ball-like surface is going to fix in the cup-like depression. Ball in the cup. So so much a strong depression will be there, and these joints will be very strong, and they're going to allow a vast movement in the joints. Examples you are having is shoulder and hip joints. They come under ball and socket joint. Okay. So this is about what are joints, what are the classification of joints, what is the structure of a synovial joint, what are the different angles or movements which are allowed in the synovial joint, and what are the different types of synovial joints. Okay. With this, we have completed the class. So if you are there, if you have any questions, you can ask me. Any questions do you have? Any questions? So here the quiz is epiphyseal cartilage are made up of which type of cartilage? Do you remember? What did I say when I'm saying the class? Epiphyseal cartilage are made of which type of cartilage? Can anyone say? Okay, it is made up of hyaline cartilage. Next you are having is synovial fluid consists of, it is made up of, any answer? Hyaluronic acid. Okay. And the last one is, yes, the convex surface fits into concave surface. In which type of joint? Yes, rightly said, it is hinge joint. Okay, very good. Now coming to the end part of this. Now this Prakara EduTech is going to they are conducting GPAT classes. And if you are interested, make use of this platform, make use of this content. They are giving you a lot of content, very valuable information they are giving. So kindly, I suggest you to register and spend some time in listening to the classes which are given by Prakara. Okay. They are really very helpful. You have got lot of resources around you. Make use of them, utilize them, and get all the benefits which they are giving you. Okay. So thank you. Thank you one and all for listening to my webinar. If you have any queries, you can comment. You can just ask in the comment section. I will be there to answer your questions. Thank you.